Thank you. My name is David Cassak, and I welcome you to the latest in our series from the Innovator's Workbench from Stanford's Biodesign program. This is the first in our series of 2005 programs, and this year we've taken a somewhat different tack than we have in the past. We'll be talking not to the folks who create new products, but to the folks who sell them. And we'll have a distinguished roster of senior medical device company executives over the course of the next couple of months, but we could have no better start than to begin with Boston Scientific's Jim Tobin. Few industry executives have had as diverse a career as Jim, who started in the hospital supply medical device industry with Baxter before moving on to the biotech world, and then eventually back to one of the most unique medical device companies, Boston Scientific. Among Jim's most notable accomplishments, he helped Biogen launch its first product, and as we all know, has played a key role in Boston Scientific's blockbuster drug-eluting stent, Taxus. So, Jim, thanks very much for being here.
Pleasure.
I know that you were born in Ohio, moved from Ohio to Harvard, then business school, Navy. Your first job was at Baxter. Why Baxter? What did you do for them?
I was a senior financial analyst because I was the only financial analyst. At the time, it was about $200 million, so it's closer to $9 billion today. And why? I just gotten married, and they offered $16,000 a year, and that was more than 14,
which was your next biggest, next highest job offer.
So it was an easy decision.
You actually moved then into international control. At what point did you realize that you wanted to actually run something and be a manager?
Yeah, it was interesting. That probably happened when I started looking around and seeing who was running things, and I sort of thought, I could do that. Yeah.
Did they agree?
No.
So, in full confidence, they shipped you off to Japan, which was your first line job. What did you do in Japan?
Well, they sent me over there it was a joint venture with the Japanese. And if you can picture this, Sumitomo Chemical, all right? Baxter, Sumitomo Chemical. I was the senior Baxter guy at age 30. And the senior Sumitomo guy was a ex-kamikaze whose mission never came up, okay? So I'm supposed to sit there and negotiate with this guy.
But do you still have suicidal impulses while you...
So anyway, I was sent over there basically to be the administrator, but they forgot to tell me that. I thought I was supposed to run it, so I did.
You took Baxter's sales in Japan from $7 million to $15 million. It was interesting. It was amazing success, but that's less than Taxus sells in a single day.
Yeah, we've had days bigger than that.
So after Japan, where did you go?
I went to Spain. We had bought a little company in a town called Valencia. And we were trying to turn it into a mini Baxter, and the guy that was running it quit. And once I got there, I found out why. And, it was a mess. And so I spent 3.5 years trying to clean that thing up.
So what precipitated your return back to the U.S.? Did you go back to Baxter headquarters in Chicago?
I went back to the IV division, which was the mother lode of Baxter, probably still. And it was very interesting because I'd gone into international to solve a problem, then I went to Japan to solve a problem, then I went to Spain to solve a problem. So when they finally had a problem in the IV business, I went to the IV business to solve a problem.
Mm-hmm. What was the nature of the problem? I mean, what had trained you to kind of become an internal fix-it-up guy?
I'm not really sure. Tell you the truth, you didn't sort of say, I want that job. They sent you. Mm-hmm. And I got sent. I don't know. I never did find out whose idea that was.
So you eventually rose to COO, where you replaced Bill Gans. By the late 1980s, early 1990s, Baxter had gone through a huge merger in 1985 with American Hospital Supply. Talk a little bit about that, because I think it was that merger that precipitated your leaving Baxter.
Yeah, it seemed like a good idea at the time. It was a $3.5 billion distribution business with some manufacturing businesses. Baxter was a $3 billion manufacturing business. And putting the two together on paper had great synergy, and we'd be able to sort of be a one-stop shop to the hospitals or hospital groups. It all seemed to make sense, but the cultures were so different. We never were able to sort of meld a 10% margin distribution business with a 40% margin manufacturing business. And so after 8 years of trying, I said, this ain't never going to work, and you ought to split it. And they said, we don't think so. And so I said, see ya. And then 2.5 years later, they split it. They didn't even bother to fix the mistakes in the plan, okay? So,
I was going to say, they did eventually do exactly, so they created Allegiance as a spin-off, and that's now
and they sold off the diagnostics business and, various other things. Edwards is now spun off, and, all those things that goes back to 93.
Yeah. So you just left. Did you have any idea what you wanted to do next?
No. I needed a job. That much was clear.
You did need a job.
At the time I had 60,000 people with Baxter, and I went to Biogen with 386, which took me a while to adjust.
Mm-hmm. You and I were talking once. You referred to Biogen at the time as the University of Biogen. Talk a little about the differences of the two cultures. And was that part of the appeal to you, that you were going to something very different, or did that kind of catch you by surprise?
Well, Biogen, at the time I went there, had 2 products in phase 3 clinicals. And the odds were that one or both would work, I thought. Mm-hmm. Back in those days, everything worked, right? At least on paper. And so from my point of view, what I was doing was getting in early enough to bring whatever was going to work to commercialization. That was the idea.
And that, in fact, was your job at Baxter, at Biogen, was to build the commercial side of that organization. Right. Talk a little about that. What did that entail, and what impact did that have on an organization that is, as you said, had 385 people, most of whom were scientists? Yeah,
it was very interesting. I mean, we had buildings full of PhDs and MDs, and everybody was just brilliant. I've to this day not seen an organization with more talent than what had been assembled in that small space. And it was very interesting because they had a royalty stream from Schering-Plough and Merck, SmithKline, that totaled about $150 million a year, and so that's what they spent on R&D. And they kind of liked that. They thought that was heaven. And, couldn't understand why anybody like me would actually want to make stuff and sell stuff. That's for those nasty commercial guys to do. We're above that.
Mm-hmm. So culturally, did you have to instill a commercial spirit in the scientists, or did you have to build a completely separate organization and let them do what they wanted to do?
We sort of walled off the ivory tower types and said, okay, now we're going to figure out how to make this stuff. We're going to figure out how to sell it. And if you don't like that, don't bother to stay. Right. And that worked pretty well.
Yeah. You said to me that when you got there, Biogen had one guy in sales and marketing. He was a former CFO, so it wasn't like instilled in the culture.
Yeah, there was nobody that could spell either sales or marketing. It was. If we wanted to cut an invoice, we'd have had to type it, and if we wanted to collect the money, there wouldn't have been anybody to do that.
And one thing is, it certainly wasn't outside of the biotech model in those days, not to necessarily drive to products, but simply to have royalty streams and licensing agreements.
Everybody talked about wanting to be a FIPCO, fully integrated, yada, yada. But a few had done it. Amgen was on the way. Genzyme was on the way. Genentech. It was a very short list, and we were trying to join that.
So you left Biogen in, 1999?
Let me think. Yeah, right at the end of... I think January 99.
And what were you thinking of doing? What were you planning on doing?
Skiing.
For a long time.
Yeah. Well, I retired.
And at that point, Pete Nicholas from Boston Scientific called you up and asked you to breakfast. What was he asking you to do?
I don't know.
And you didn't want to go at first.
I was busy. I had more skiing to do.
Did you know Boston Scientific at the time?
No, I never met Pete. I'd talked to him once before. He'd call me up once, and no thank you.
What made you eventually decide to join Boston?
It was interesting. We had several breakfasts, always off in some neutral place. I don't think he really wanted me to see Natick. We went round and round, and I was busy skiing. I had other things to do. And then finally, about the third or fourth time we met, he said, look, I need help. And, what are you going to say, no? Somebody says they need help, you say, yeah. And
you said to me that you helped Boston Scientific over the hump. Where was Boston when you joined them, and what exactly were the challenges that lay ahead of them?
Well, it was about a 20-year-old company at that point that had grown organically from $2 million a year to, I don't know, maybe a couple hundred, which is pretty dramatic. And then in about 94, they decided that it was either buy or be bought, which probably was correct. And so they decided to be a consolidator and started to do that. And they started buying things, and every penny that came in got spent on stuff. And that was working really well, and they were growing very rapidly until they basically outgrew their ability to manage what they bought. And so it just hit the wall.
Was it an issue of internal processes that had gone wrong? Was it an issue of sales forces that couldn't keep up with? I mean, what was that? What was that wall?
The sales force was the good news. To this day, there's few organizations that can sell better than Boston Scientific, but they thought they were being fast. In fact, they were being half-assed. Okay, and so you never had time to do it right, but you always had time to do it over. And they just literally just outpace themselves. And you can get away with some of that when you're smaller, but when you get to be a couple $2 billion, recalls hurt, and it was chaos.
Were there cultural issues at Boston Scientific as well, in the sense that you were shaking things up as at Biogen, or were the people there that you were asking to make adjustments wanting this help and wanting this?
It was very interesting. It was like, the people that were there were terrific, but there were empty chairs. The day I walked in the door, there was no head of manufacturing, there's no head of quality, there's no head of regulatory, corporate level I'm talking about. No clinical head or otherwise. There just was none. Didn't need that, the guy running R&D was a great customer guy. He was very knowledgeable individual, but he couldn't run a project. He just didn't have that DNA. And so the sort of the infrastructure side of the business was just dysfunctional. And it wasn't a matter of firing somebody, it was a matter of filling empty seats.
Mm-hmm. You were back in the medical device world again after your stint at Biogen, but did Boston Scientific, to you at the time, culturally feel more like Biogen in the sense that it was a group of really smart folks developing innovative new technology, or did it feel more like Baxter, which is about getting products through quick iterations and stuff? Did it feel more like you had just moved into another type of more advanced Biogen, or very different than that?
Not really. It was its own thing. Still is its own special culture. It's hard to explain, but there were lots of good people, but they spent more time telling themselves that they were great than actually being great. They didn't know what excellence really looked like, and so they weren't trying for it. Okay, and so it was a matter of saying, the bar's here, not here. And I know you can do it, but you damn well better get after it. Okay, and off they went.
One of the it seems to me, issues in the Baxter American Hospital Supply clash was that you had a very sales-oriented organization versus a very internally, financially driven organization, and that was where the culture clash came. Carl Baza and his guys would spend anything to make a sale, and Baxter guys would do anything to drive a profit. What culturally were you doing where culturally along that kind of spectrum did Boston Scientific fit in those days?
Well, somewhere in the middle, I guess. We had 65%, 66% margins at that point, which compared to a Baxter at 40 was pretty good. Okay, compared to a Biogen at 90, not so good. But when I went through the plants before I actually ever even started, and you could just see money laying around. It was just amazing how much money they were wasting, but they were happy with that because, we have 65% margins. Well, okay, so what we ended up doing actually was we didn't put a quality program in or any of the fancy stuff that you read about. What we did was say, we're going to focus on process control, which drives a lot of positive things, including costs. We ultimately ended up improving margins by about 6 points, took that 6 points, and put it into R&D. So R&D went from 6 to 12. Actually, it ultimately went to 14 to develop Taxis, while it was literally money off the floor in the scrap bins that we used to develop Taxis.
Right, so that money was used for tax development. Tell us the story of tax development. How different did it feel in terms of a technology challenge for Boston Scientific? Did it, because of the drug component, did it seem like an outlier, or was it right in Boston Scientific's sweet spot? Maybe you should begin with a little bit about what Boston had done in coronary bare metal stents prior to that point.
Well, not much. We had this arrangement with Medinol that was fraught with difficulties. Tried to work with them, couldn't. Tried to buy them, couldn't. So, see ya. All right. So we had developed our own stent. We'd been good at catheters for a while. We developed our own stent, and then coating that stent was, a different challenge. We had a small group of people who approached the problem as a drug delivery problem as opposed to a stent problem or an engineering problem, and that was really key. When you look at there are 80 companies that make stents. Making stents these days is not exactly rocket science. Okay, and there were something like 9 programs that were trying to do coated stents, and 2 have gotten approved, and we can actually make ours. And so, arguably, we did better than all the rest. Okay, why would that be? How do we get so lucky? Okay, and part of it was luck. Part of it was that we approached the problem not as a device problem, but as a drug delivery problem, not as a molecule problem, and not as a device problem, but a drug delivery problem. That was our mentality, and we made decisions that way as opposed to making engineering type decisions. In other words, you actually had to have some damn data. Mm-hmm. All right, and that was a new concept around the place. But ultimately, when we made our decisions off a fact base, it worked out.
So in 1999, 2000, you are Boston Scientific in the whole area of stents is looking up at Guidant and
everybody,
AVE, and maybe even still J&J.
We were like 5th out of 4.
Right.
Okay.
Were you conscious of Johnson & Johnson's, what seemed at that time, lead or head start in this area? Were you?
I wasn't competing with them. Okay, I was just trying to get this thing done. They ended up getting there ahead of us time-wise, but we never said we'd be first. We said we'd be best, mm-hmm. and we took the time to be best. They took the time to, race through the stoplights and ended up not being able to make what they'd invented.
Mm-hmm. I want to ask you a little more about that, but just anticipation of that. Did your background at Biogen help you at all in understanding what the challenges were as Boston Scientific worked in this drug-oriented device world?
No question about it. The flavors of decisions that had to be made around formulation and how much evidence we would need, how we approached it, how much animal work we would take in order to be convinced that what we were doing was good. We all that stuff were things I picked up by listening to people at Biogen. You're not born knowing this stuff. Okay, you got to listen to people who know what they're doing. And I had spent 5 years listening to all those PhDs that really knew their stuff. And I might have picked up 2% of it, but it happened to be the right 2%. Mm-hmm.
Did anybody at Boston Scientific say, no, you don't understand. We're not a drug company. This isn't necessary, or did they understand instinctively what you were talking about? If
I heard you don't understand once, I've heard it a million times. Okay, and in one ear, out the other.
Mm-hmm. Now, Boston quickly leapfrogged Cypher for the lead in drug-eluting stents, and I guess the question is, you made reference to it before, but why do you think that happened, and what do you think Boston's got to do? What can it do to sustain that leadership? What's the key to sustaining that edge?
Well, we got the lead because we were prepared we had great data. We had arguably the best stent in the business at that point, certainly the best coated stent from just a physical stent deliverability point of view. Best stent, best catheter sort of thing. And it was available. All right. I built capacity for 100% of the market. who in their right mind would do that? Okay, and the answer is, I think about capacity differently from the way most people do. People think about annual capacity. That's a meaningless number to me. What matters is surge capacity, recovery capacity. If you get a surprise, more demand than you expected, or a recall or something, you need to be able to recover quickly. So I built capacity to be able to handle all of that. People thought I was crazy, including my own folks.
So finding the right drug must have been critical to this whole process. You began with no, was it not as critical as it sounds?
Well, it happened before I got there. So, I mean, that decision was made before I ever walked in the door.
Was that a luck decision, or was there more thought and study put into that decision than appears on the surface?
Well, depends on who you ask. I mean, if you ask the honest folks in the organization, they'll tell you they had no clue what they were doing, and they just lucked into it. Okay, there's a few others who have a different version of the truth there, but I think it was luck.
Did you ever look at guidance experience with antimycin and just say, "There, but for the grace of God, go we"? I mean, the relationship with Angiotech was just wonderful from the beginning.
It worked out great. Angiotech has been a perfect partner. I mean, really, it's amazing how the two organizations have been able to dance together. As far as actinomycin goes, I don't know why that failed. Okay, I mean, is it the drug, or is it the dose, or is it the duration? A miss on one is a miss on everything. I don't know what the problem was there. It should have worked.
After the Medinol experience, were you at all reluctant about signing an alliance with someone for so critical a part of the component? Did that give you any pause?
Well, it was already done. Point one. Point two, all we were accessing there was the IP. They don't sell us the drug. They don't sell us the stent. It's just the IP rights. Everything else was within our control. And the problem with the Medinol thing was simply that it was a 50-50 deal, which meant that there was no tiebreaker. And so if they thought this and we thought that, there was no way to resolve that. So you spent all your time circling around an issue when there's all these other things that should have been being done. You didn't have those kinds of problems in this deal.
Taxus in particular, and drug-eluting stents in general, are arguably the first real blockbuster product the medical device industry has seen. Last year, Boston Scientific sales increased $2 billion in 1 year over the previous year, 60% top-line growth, 160% bottom-line growth. What happens to a company like Boston Scientific when you suddenly get that kind of product and that kind of growth?
Well, it's very interesting because in the drug business, you can subcontract everything. So once you've had a CRO help you get, a trial that works, and you've, maybe gotten through the agency with the thing, you can have it filled someplace, labeled someplace, packaged someplace. You ship it to a wholesaler who sends it to, the only thing you got to do is collect money from the wholesalers. That's not the business we're in. Okay, we had to make every one of those catheters. We had to make every one of those stents. We had to code every one of those things, sterilize them, test them. The testing is as hard as the making, and then ship them and collect the money. And to grow, it took us 22 years to go from start to $2 billion, and 3 years later we grew that much in 1 year. The effort that literally thousands of Boston Scientific people put into making that happen is just astounding. And I told a group yesterday that I literally had to tell the guys in Ireland not to work Christmas. Okay, they were going to work through Christmas to meet our inventory needs. I said, take a couple of days off. Okay, it was unbelievable how they put their shoulder to the wheel on this thing. But that's what it takes to grow, to cope with a $2 billion increase in 1 year.
A lot of areas of Boston Scientific must have had to adjust to this sudden, tremendous windfall, but it seems to me that the sales force must in particular. How did you deal with the sales force that was suddenly going to be selling far in excess of anything it had ever done before? And did you plan for that? Had you anticipated a $2 billion increase? Well,
actually, I had. Okay. That's what we budgeted. And think about that one. It was very interesting because 3 years ago, we have an analyst meeting, every January, February. And 3 years ago, when we were, just starting to see data, I always take 3 minutes at the end and tell them what's going to happen. Okay, and then that 3 minutes I said, look, we've got good data. It's a great product. It looks to me like a 65% market share product. I'm going to build capacity for 75%. Mm-hmm. The room erupted in laughter. Okay? I mean, it was just such an unthinkable thing that I would be planning for 65% market share. That literally the place laughed me off the stage. They're not laughing now, okay? But it's what it looked like to me, okay? I mean, just straight up looking at the data, it looked like this ought to be a better product.
And you dealt with the capacity issue early on, which, no secrets told, has been a problem that has plagued Johnson & Johnson and Cypher. Did anybody come back and tell you, boy, you were prescient in seeing that capacity issue, which really has been a critical issue in this space?
Well, this is kind of what I do, so, that was not... that was no surprise. I mean, if you look at the Avanex launch, to this day, I don't think Avanex has ever suffered a single back order. Okay, and it goes back to the Baxter days when this is ancient history now, but when we launched premixed drugs, we were putting the hospital pharmacy in the basement out of business because those techs would go someplace else. So we had to have 100% service levels, and we did. Okay, so that's just the way, that's my game plan.
Given your background in the biopharma space, generally speaking, though, do you think blockbusters are good for device companies, obviously drive tremendous resources, or do you worry about the impact of blockbusters on companies for all the reasons that critics of big pharma say? They're difficult to follow, create kind of corporate dependency on the big play. If tomorrow someone came to you and said, we've got another blockbuster, would you say bring it on or take it somewhere else?
Nobody in their right mind would say no. I mean, you can look, the analyst community I view as a lagging indicator, okay? You do what you do, and you succeed, and they'll have all the reasons why, okay? But I don't think there's anybody in the room that would trade $1 million an hour worth of sales for, let's not grow so fast. If that's our biggest problem, bring it on.
So another way of asking that is in the early 2000s, Boston was kind of best exemplar of a very different kind of technology development models, acquisitions and alliances with small device companies like Enteric Medical that, would have small incremental impact on the company's revenues. What happens to that model when drug-eluting stents come along? Can you still pursue those kinds of opportunities, or has the success of Taxus really changed Boston Scientific's approach to value creation?
Yeah, that's a really good question. First of all, the myth is that all of Boston Scientific's growth was driven by technology they had acquired. In fact, if you think about it, the catheters, Boston Scientific, the stents, Boston Scientific. The drug IP was Angiotech, but the making that into a product was all internal. And that's Taxus, okay? The next big thing we're doing is also a completely internal development effort. And so there's probably a reason why people think that all of our growth has come from outside, but it really hasn't. Okay. On the other hand, the success of a Taxus, we're generating $200 million a month in cash, free cash flow. Okay, that gives you some horsepower to do, find the whatever it is that you think you need to continue to grow, and we can afford it. All right, so the model stays the same. It just becomes way more affordable, and what's left buys back stock.
Now, you said before that analysts are kind of lagging indicators, but analysts have already begun to question whether by 2007 Boston can sustain the kind of success it's had. I guess one is, do you agree with that assessment? And number two, I was going to ask, is that the problem with blockbusters? But I think you just answered the question. Taxus seems in a lot of respects a truly disruptive technology for device companies just because of its tremendous impact on sales. Do you see it as a disruptive technology?
Honestly, no. I think it's a step on the way. I think the device business, the device industry, is an incremental kind of thing. There was angioplasty, then there were bare stents, now coated stents. Who knows what comes next? Maybe it's dissolvable stents, maybe it's, I don't know. It could be lots of things. But this 20 years from now will be viewed as a sideshow. It's not a revolution in anything.
So to your mind, how dependent is Boston Scientific on a sustained Taxus franchise as opposed to what seemed to be the model earlier, pre-Taxus, of a lot of different technology plays going to a lot of different customer segments?
Well, obviously, this year will be $6.5 billion roughly. $3 billion of that will be one product worldwide, if we're lucky. And so it's very important that piece of the business, leadership in that piece of the business be sustained. The history is thought to have been that leadership in stents is up and down. Everybody's been a leader at some time in the last 10 years sort of thing. If you really look at that, the reason that happened was whoever was the leader fell behind in technology. Well, with $1 million an hour coming in the door, there's no real reason why I should fall behind on technology, okay? And so if we're lucky, if we continue to invest intelligently, there's no real reason why we have to concede leadership in this business. Now, the business will eventually peak out, but with the resources we're talking about, there's no real reason why we can't find lots of other ways to grow besides coated stents.
You'll have tremendous resources, but there's a school of thought about innovative technology, which is that the companies who are really successful with a single technology simply find it difficult to obsolete or invent the next generation, the next iteration of technology, because they've been so good at selling their existing technology. How do you avoid that kind of complacency that comes with, we've been tremendously successful, we know what we're doing, we'll be on top of the next change? What's the message to your R&D guys? Do you need to reinvent the drug-eluting stent to sustain Taxus franchise, or is it incremental enhancements?
Well, in the short term, it's incremental. The next big idea hasn't really happened yet. So, what does that entail? Well, the Express stent is the best covered stent, coated stent in terms of deliverability, okay? But there are other stents, designs out there that are more deliverable. So we need to coat one of those, okay? And that's what Liberté is about. And I think, because we've been so focused on Taxus Express, I think the Liberté has been thought to be just a marginal improvement. And it's really not the case. The people who are using it, and by the way, we're shipping it. I keep hearing about all these guys who are going to do X, Y, and Z. We have this program and that program. We're doing it. We're shipping as we speak. We're shipping our second generation stent. Who else can say they're even doing that first generation except for J&J? So we're not waiting for somebody to knock us off. We're just moving as fast as we can possibly go.
When John Abel was here, we talked a little about Boston Scientific as it evolved through the years, and one of the things that we talked about was that if you think about Boston Scientific, particularly in the years before you got there, in the mid-1990s, it really pioneered a different kind of device company model than one that we almost take for granted today. Quite unlike Bard and BD and even Baxter, the companies that were stalwarts and mainstays of the device industry, who sold, focused on high-volume products sold to hospitals. Boston was really about a physician-oriented approach that stressed high-tech devices that have a real clinical impact. And again, we take that for granted, but that was really unusual in 93, 94. Was Boston Scientific different in 1999 than Baxter was in 1989 in its fundamental approach to technology, do you think?
Well, yes, in a word. I think that, Boston Scientific has always had the physician as its customer, but has thought of the patient as what we're good at is putting tools in docs' hands so they can do things they couldn't do before. And that's it. That's all we do, really. And, today a lot of companies will say that's what they do. But, at the outset, who would have thought back in '78 that you could sell $5.5 billion worth of catheters. Okay, I mean, no, you're nuts. But that's what's happened, and I think it's because the organization, its DNA is aimed at solving problems or allowing the docs to solve problems that they haven't been able to solve up until now, whether that's internal or external. There's no real distinction between what we do ourselves and what we bring in, and these days more or less finish. Okay.
For a very long time, Boston Scientific was headed, or at least identified, with two very different personalities with two very different skill sets, Pete Nicholas and John Abley. What was it like working with both of those? Were you closer to one than the other? Did you ever feel caught between those two very different personalities and different visions of Boston Scientific?
Well, first of all, I think Pete and John, although they're very different people, are highly complementary. Okay, and so over the years, I don't really know how they've worked out all those differences, but however they did it, somebody ought to write that book, because that's pretty good. But Pete was more commercially oriented, and John was more tinkerer, solving problems oriented. Nobody was sort of make it right oriented. And that was part of the problem. And so that was sort of a void I could fill. And truthfully, when I was first there and I'd stand up in front of the organization, I'd start talking about process control. The eyes would glaze over. Why are you talking about that? The issue is new products. Yeah, well, that's an issue too, but we're not going to have any money for that if we don't solve this problem. Okay, and that was. There were many times, I think, when either or both of those guys wondered if they'd made a mistake.
Bringing you on.
Yeah.
Well, let me ask you a question about that, because when he was here, John made a distinction between companies that are small, entrepreneurial, creative, and innovative, and those that have become big and bureaucratic. And that's almost the Boston versus Becton Dickinson. I don't mean to criticize Becton Dickinson, but I think that's a fair distinction to make. Obviously, Boston in its earliest days epitomized the entrepreneurial, creative side. But as it gets larger and is more successful, how true to that original vision do you think Boston can stay? How different is it? And in a certain sense, did your arrival and the expertise you bring suggest that Boston had already become a very different kind of company?
Well, the fact that they were having terminal problems, okay, and it was visible to everybody. It was in the papers. It was as obvious as it could possibly be. It was hard for people to deny that something had to be done, okay, no matter how hard they tried. And one man's bureaucracy is another man's process, okay? And they were so anti-bureaucratic that they had created this myth that somehow if they just tried hard enough and let the chips fall where they will, that magically it would come out right. And that ain't how it works, okay? So some of the changes that I was instituting, and I didn't actually spend a lot of time debating this with anybody, okay? I just did it. Some of the changes, the old guard called bureaucracy. Well, that's an incendiary word around Boston Scientific, and if you want to create a problem, say that's bureaucratic. And I basically took the attitude of I kind of think I know what I'm doing. I kind of think you don't, and so sit down, shut up, or leave. I'm doing it. If you don't like it, so fire me, and I'll go back and ski. Okay.
You always have that to hang over the head,
right? And honestly, you almost have to have that kind of mental independence to do this sort of thing. All right, because if you're worried about what people think, you could never get from here to there. All right, you will eventually pull a punch and it'll be fatal. So, a little Irish is a good thing.
Well, speaking of that, on a personal level, this series has really been about folks devoted, who've been innovators, people who've created something new, something valuable that wasn't there before. And certainly Taxus and Ironex are examples of that. But as you think about that personally in what you've brought to Boston Scientific, do you think about what you do as being creative? Is creativity what you bring to Boston Scientific, or is process the enemy of creativity?
Well, I'm not sure that I would buy into that, okay? You need light touch process. There's such a thing as too much, but none is fatal, okay? And so, no, I don't think what I did really qualifies as creative at all, okay? The creativity was in the organization, but somebody's got to focus it. Somebody's got to direct it. Somebody's got to say, no, that's not good enough. Somebody's got to recognize good data when they see it, and you got to be able to think broadly enough to touch all the bases, and that's the part that I could bring. All right, I said it's sort of this mental checklist that says, if we don't have an assay to prove that what we just put on this stent is what we said we were going to put on the stent, we don't have a product. Well, that's a damn revelation to a company that's just used to making a device and shipping it. Measure it, it's fine, out it goes, right? Assays, well, how do you spell that? So there were some, I could fill in some of the blanks. I guess that's the part. But creativity, I don't think I got a creative bone in my body.
We're getting close to the end here. Let me ask you just one or two more questions. As I said in my introduction, few executives had as diverse a background as you've had. Culturally, how different were the three companies that you worked for? And when you look at successful organizations, because all three were extremely successful organizations, at least by the time for Baxter and Biogen when you were leaving, are you more struck by the similarities of successful organizations, or do you think that each successful organization defines success in its own terms?
I'm more in the latter camp. I think that there are lots of ways for people and companies to be successful. I think that, my basic philosophy is there's a whole bunch of different strategies. Some of them are pretty good strategies. It's a waste of time to try to distinguish among the good ones. Pick one and then make it work. Just refuse to accept failure on whatever you've picked. And each of those have done that in their own way. I think that's a more successful model and a more sustainable model than all the wasted consultant time trying to pick the perfect strategy. I think that's, the only perfect strategy is the one you decide to execute.
As you think about your career, and obviously I don't mean to retire you before your time, but what do you think your legacy has been for each of the companies that you've made tremendously successful? What do you think's been your most lasting or important contribution to them?
I can tell you what I hope it is, okay? Because I'm not sure it is. But when you look around the industry at the number of people who were my more or less peers through the years, I was there for 22 years, so from 200 million to 9 billion, you meet a lot of people. A lot of those people are running companies today, okay? And when you look at Biogen, and when you look at the Biogen headcount, the day we launched Avenex, something like 12 of those people today are CEOs of something or other, okay? I hope that, the association has resulted in those guys being just a little bit better. And if that's the way it turns out, I'll be real happy.
Well, great. Well, Jim, thank you very much, and it's just been great having you here. Thanks very much.
Thank you.